everyone, welcome. We're just going to wait a couple more minutes as people sign up, and we will start our news update for tonight. Thank you everyone that has been joining us. We definitely have a lot of people interested. And we're very excited to be able to host this live update for you tonight. All right, everyone. Thank you for joining us tonight. My name is Natalia Morrison, and I am the Executive Assistant for FSOMA. Yes, and I see some of you have found the chat box. So for all of you joining us tonight, when you have comments, questions, insight that you want to share with us, I encourage you to please go down to the bottom of your screen. There's a little bubble icon. That's the chat icon. You click that and make sure that you're sending your comment to all panelists and all attendees. That way we can all see the message and start the conversation. So in the meantime, why don't you type in the chat box and tell us what city you are located in. We would love to know. I am personally in Miami. Oh, good. Fort Lauderdale, Tallahassee, Brandon, Orlando, Dundee, Jacksonville, Gainesville, Wellington and Palm Beach, Orlando, Fort Myers, Coral Gables. Hey, neighbor. All right. Oviedo. Wow. Green Acres, Seminole, Pinellas County. There's some that I can't pronounce. New York. Hey, New York City. Thank you for joining us. Jason from AccuMarket. Wonderful. Thank you for joining us, Jason. We got, someone that practices in Georgia and Tomsville, Denver. Awesome. Vero Beach. Thank you all for joining us, honestly, in St. Petersburg. It means a lot for us, for you to be involved. A reminder, FSOMA was created by Florida licensed acupuncturists for our members, for you licensed acupuncturists. We are all in this together, and right now globally we're all going through a major rapid shift, and we're all trying to adjust as quickly as we can. I know there is a lot of fear and a lot of uncertainty. A lot of you are having to close down your clinics, and we're all trying to adjust the best we can with the tools and our training and the wisdom that we have as licensed acupuncturists and acupuncture physicians here in Florida. So tonight's focus of our conversation is obviously the COVID-19, the coronavirus, and its impact in our profession. I encourage all of you, as we have this conversation tonight, to please write in your comments. I will be monitoring the comment section throughout our live presentation. I am also going to try and broadcast it live and stream it live on Facebook. So you can also go on to Facebook and share it with your fellow colleagues as well. I'm gonna start off introducing Ellen Teeter. She is the executive director, for FSOMA. She's been with FSOMA for a very long time, very involved in making sure that we all have the information that we need. She's gonna talk a little bit about the current announcements that we have on our website. If you want to check out our website, it is FSOMA, FSOMA.org. And she's also going to talk a little bit about telemedicine. We have partnered with Galina Rufner, who has an online webinar on telemedicine. Ellen will go ahead and talk to you about that. And then she's going to introduce to you our Vice President, David Bibby, and he's going to go over other topics that are going to impact us and our profession in regard to the COVID-19. So thank you, everyone. Thank you for joining us. And here is Ellen.
Okay, thank you. Yes, I'm in Bradenton, Florida. That's on the West Coast, just north of Sarasota. I know the Pinellas County names. So thank you all for attending. I've been with FSOMA board for probably close to 15 years now, and then served as president, and then in 2015 moved into the executive director position. So I'm a paid employee now, and that's the deal. But I'm kind of the person you call on the phone when you need help, and the person that puts out the emails. So if you have questions or comments, let me know. On FSOMA.org, that's FSOMA.org, I do have an announcements section that everybody can see. When you go on there, the first article on there right now is about some temporary updates on telemedicine. Thought it'd be good to go through them. It's basically saying that we can use some platforms to do telemedicine that were not or are not usually authorized. You usually can't use them. Those are Apple FaceTime, Facebook Messenger video chat, Google Hangouts, or Skype. Some of the other platforms are not allowed still, and I'm not even going to say them because I want to just emphasize what is allowed. Apple FaceTime, Facebook Messenger video chat, Google Hangouts video, or Skype. So you can use those platforms to do telemedicine with your patients. If you go to the announcements section, you'll see, click on the link and you'll get a PDF with some other links to other information, which is more just kind of where this was drawn from, but also you might want to update them once in a while and look and see if there's anything new coming out. Galina does have a class, and there's a link there to her class. It's a 4-hour webinar on the telemedicine. So if you're not familiar with telemedicine, it'd be a good thing to go through that. So that's pretty much my update on telemedicine. A lot of people are exploring it and thinking about it. So are there any particular questions about that?
Could you go over that list again so I can type it in the chat box? You said FaceTime, Facebook Messenger?
I'll type it in.
Okay. Perfect. So if you guys are watching, if you have any questions in regards to what Ellen just mentioned, go ahead and type that in. So we have Apple FaceTime, Facebook Messenger, video chat, Google Hangouts, and Skype. So we have one question coming in. Can we just offer telemedicine to patients that live in Florida? I'm assuming.
Yes.
I believe, I'm not sure what the rules are on that. David, do you know? There are rules.
Yeah, you have to be, we're only licensed to practice in Florida, and so we can only treat patients that are physically in Florida.
Okay. So let me introduce you to David Bibby now. He's the FSOMA Vice President. He's worked very hard on legislative issues. He led the court case, coordinating our legal team when we sued the Board of PT a couple years ago. He's a leader in your profession, and I'm happy he's here to share his information about the practice of acupuncture during this time.
Thank you, Ellen. I welcome everybody this afternoon, this evening, and thank you for taking time to lean in a little bit on the question of how the COVID-19 virus is going to impact our profession. There's 4 topics that I identified this evening based on some questions that Ellen's been getting and things that Natalia has shared that are surfacing on social media. It's obvious that there's a lot of questions in the profession regarding whether or not these 4 things is whether or not we can remain open in practice during a state of emergency, and the question of, legally, can we do that versus should we do that are 2 things I want to try to address with everybody. And then I wanted to have a brief discussion about the difference between essential medical services and how essential medical services are determined in terms of what is essential. And then we're going to summarize on a couple of points, and I've got another bit of news to share with you. So the first question is, can acupuncturist's office remain open for patient care during a state of emergency? And we looked to a couple of resources, and based on current language, all of this is subject to change because the CDC provides input, the federal government provides input, the state can provide input, and then your local government can provide input. So I can only speak to the state of affairs right now, 5:09 p.m. on the 20th. And when you look at the first reference that I had for you guys is a Miami-Dade County Declaration of Local State Emergency that was issued yesterday at 5 p.m. And there, the mayor is probably drawing from state statute. And so it's a decent, updated resource for us to use to try to see what might be applicable elsewhere in the state, because there's no specific guidance on it. You have to just sort of look for what's common and usual. And right now, what the Miami-Dade County has provided was a statement that said all non-essential retail and commercial establishments are ordered closed. So one more time, all non-essential retail and commercial establishments are ordered closed. And that's directly followed by a statement that says essential retail and commercial businesses which may remain open are the following. And then there's a long list of things that follow. But it starts with healthcare providers, including but not limited to hospitals, doctors and dentists' offices, urgent care centers, clinics, rehabilitation facilities, physical therapists, mental health professionals, psychiatrists, therapists, and pharmacies. Now, it's the first sentence or the first word is healthcare providers, and then it goes on to say including but not limited to. So this list is not meant to be a comprehensive list, but it gives us some guidelines to go on. So the very first item is healthcare providers. Acupuncturists are licensed and regulated as healthcare providers in Florida, and specifically, we have a reference to Chapter 456, which is the statute that governs healthcare professions and occupations. And in its very first section for definitions, healthcare practitioner means any person licensed under, and it starts with Chapter 457, 458, 459, 460, and it goes on. But it starts with 457, which hopefully everybody on the call knows is the Practice Act for acupuncturists. So when you combine the fact that they're including essential retail and commercial businesses which may remain open, include healthcare providers, and Chapter 457 providers are in statute defined as healthcare practitioners. I think that's pretty clear that that we're listed among the essential commercial businesses, unless you retail, but essential commercial business that can remain open. That's as a matter of law. Now, that's subject to change. They can always restrict that either federally, statewide, or locally. So if you get guidance from somebody in your local community and they have an ordinance that is more restrictive than the language we're using, then of course you're going to have to obey the law in your local area. But for the time being, that's the guidance. The topic that I think is slightly more important for us to consider is whether or not we should be open. And I'm just going to read from my notes so that I stay on task with this. But this is a little bit harder to answer. It's harder to say, and you have to carefully consider the following things prior to treating patients in your office at this point. And I don't mean just the state of emergency in Miami-Dade, that area. I'm talking statewide. The things that we really need to consider are practitioners have to look at performing a risk assessment for their office. And what you need to consider is the CDC guidance on individual movement. You know, what is the attitude about people moving around, leaving their homes, you know, at this time and then in the future, as to whether or not they should be keeping appointments in general, or as it might apply to our office, and the agency's stated preference for people to avoid unnecessary travel and contact with others. So it's just a simple kind of a question that we need to ask ourselves is, you know, you know, I'm not requiring, but scheduling and expecting and having people to leave their homes to come to our office by whatever means necessary. Are they driving or taking a bus or taking a cab, or, you know, whatever's involved there? They have to leave their home and expose themselves to the elements just to get to our office. And then the question is, once they get to your office, you have to consider the Florida Department of Health and the CDC's guidance on preparedness for providers to screen, report, and refer patients who answer positively to viral screening questionnaires, or maybe they exhibit viral infection symptoms. Okay, so what happens if one of these patients of ours comes and they're exhibiting some type of positive sign that they're infected with COVID-19? How do we respond to that? And, you know, the CDC and Florida Department of Health have guidelines and specific ways that healthcare practitioners and providers are supposed to respond to those things. So you need to be aware of what's required statewide and locally. Also want to be mindful that the CDC and the Florida Department of Health have recommendations for the use of disposable personal protective equipment to safeguard the health of patients, providers, staff, family members, and the community at large. And so you need to take a look at your inventory of personal protection equipment and answer the question as to whether or not it's adequate to meet the need where your patients and staff safety concerns might be. The Department of Health and the CDC have links to those guidelines. They're available, they're updated constantly, and they're available online. I think FSOMA has sent out several emails with a group of those links for the CDC. They may even be on the website homepage at this point. I think we can probably have Natalia or Ellen address that later. And then last, we also want to, or not last, but also consider compliance with sanitizing your office and its equipment to reduce the risk of viral transmission. You know, at this point, we really need to consider everybody that's walking around is positive for the virus. And the same universal precautions that we would take, we need to consider not only universal precautions, but the enhanced precautions that come with providing personal protective equipment for yourself and your staff, as well as having a detailed plan for a policy and procedure in your office for sanitizing the office in between patients, certainly at the end of the day. And these are things that you really need to consider if your office is going to be open. And I say that only because updating these policies and procedures are going to be important in the event that your office is visited by a member of the DOH or a local health inspector. Is if you're seeing patients, legally you may be allowed under the discussion we had a few minutes ago, but at the same time, your compliance with these types of guidelines is going to be paramount from a risk management standpoint, avoid, running afoul of local ordinances or maybe the law or compliance under these emergent conditions, okay? So again, consider the CDC's attitude about people moving around. Consider your preparedness to screen, report, and refer patients who not test positive, but people who answer positively to a viral questionnaire. Consider the recommendations for use of personal protection equipment. Do you have that available in your office at this time for yourself, your patients if necessary, and your staff, in compliance with sanitizing the office as well as updating your own policies and procedures and to observe and document patient history, okay? I have a resource that I shared a few minutes ago with Ellen, and it's just the printed materials that I'm working off of. They have some links to the CDC. They have links to the Miami-Dade ordinance and a few other things that can be helpful. And that's going to be made available to everybody on the FSOMA website as a PDF, I imagine. Probably, by the end of the call, if not soon thereafter, okay? So as I keep looking down, I'm referencing that, but we have resources for you to click on if you want to look at sources or more detailed information. I think the other additional considerations that you need to consider is healthcare practitioners, this comes from the CDC, should work with their local and state health departments to ensure that local protocols and guidelines, such as updated additional guidance for cleaning, disinfection are followed, as well as identification of new potential cases. And this is sort of the benefit and the burden side of being a healthcare provider. Certainly we all want to treat and aid our patients in this time of need, but we do have responsibilities that go with our licensure for compliance with local and state regulations. And so we need to be mindful of what those are and how do we communicate them, okay? They should also, if your office is open, the CDC is reminding everybody that we should educate staff and workers performing cleaning, laundry, trash pickup activities to recognize symptoms of COVID-19 and to provide instructions on what to do if they develop symptoms within 14 days of their last possible exposure to the virus, okay? So at a minimum, any staff should immediately notify yourself or somebody in responsibility in the local health department if they develop symptoms of COVID-19. The health department will provide guidance on what actions need to be taken. That's your local department. We should also develop policies for worker protection and provide training to all cleaning staff and vendors that might come in contact with patient or patient materials. And training should include when to use personal protection equipment, what is necessary, and how to properly put on and take off that personal protection equipment. Practices and employees should also ensure that workers are trained. We do this anyway, but make sure that they're familiar with hazards for cleaning chemicals used in the workforce, used in the workplace according with OSHA standards, as well as bloodborne and, at this point, airborne pathogens. Okay, so if you're going to be open, and the law says that you can be, these are just a couple considerations or a few considerations that you have to bear in mind that that need to be in place in order to protect yourself, your staff, and your patients, because we have an obligation to all three of those, as well as the community at large. So does anybody have any questions about that before I move forward?
We've had a lot of questions come in. Let me just, okay, so the first one was, are we allowed to treat patients? I think you've answered that. The information on telemedicine, we're gonna bring that up. What if we are in Florida? Doesn't this count as virtually in Florida? Yes, it does. I am also licensed in Georgia too. Can I offer this service in Georgia. You're gonna have to call the your acupuncture board in Georgia to find out what their telemedicine guideline is. Although, Ellen, if I'm not mistaken, it was a nationwide adjustment on the telemedicine, right? Oh, hold on, your mic is off.
That was just on the platform you could use. All the rules about crossing state lines stay in place, and those will vary state by state. There's probably not a quick answer, but perhaps if we can get Galina to either answer that next week or jump on with a
No,
comment.
she's on. Actually, let me, I can get her on now. Go ahead.
I was going to say at the end of my comments, I was going to share something that was just released just a couple of days ago. There was a suspension of statutes and rules that was made necessary by the COVID-19 virus. And what it says was that any licensed healthcare provider who holds a unencumbered and free active clear license in any state in the country can practice in Florida for the next 30 days. And that includes acupuncturists. So if you're an acupuncturist in another state and for some reason you wanted to come to Florida to support patient care treatment in a way that consistent with Chapter 457, that's allowed. And it's going to be allowed for 30 days or longer if provided by order. So that was just signed on the 16th, a couple days ago. But it's an attempt to, allow physicians, nurses, respiratory therapists, healthcare professionals of any discipline that's licensed with an active clear license anywhere. They're all welcome in Florida.
Wonderful. All right, so I brought Galina on. Galina, can you hear us?
Yes, I can. Can you hear me?
Yes, perfect. Thank you for joining us. So,
appreciate.
Oh, sorry, I couldn't hear you.
Thank you very much for invitation. Appreciate.
So we're just reviewing some questions, and then maybe you can talk to us a little bit about telemedicine. I know that you're in Ohio, and so far it's been different state by state, but it seems that we're adjusting every day. All right, so next comment was one thing to look into. Is the president lifted doctors from practicing only within their own state? Yes, which is what David just mentioned.
Not necessarily. On the federal level, so far as yesterday, the proposal went to lift state line restrictions, but it has not passed yet, and we do not have the release to practice across state lines yet on the federal level. But yes, David is correct, and Florida permitted other physicians to practice in Florida, but Floridians cannot practice in other states freely yet.
Perfect. Thank you for that clarification.
Yeah, what I was saying, the state surgeon general, Scott Rivkees, he signed an order that basically released the state barrier for licensed practitioners from other states to come to Florida. So it's a little bit of a one-way street. Okay.
Yes, it's one-way street. The major reason because Florida is such a snowbird state, and a lot of the patients are right now in Florida, and they are frantically trying to reach their family physicians in their state of permanent residence. That is the reason.
That makes sense. Next comment.
So Natalie, let me also a little bit elaborate on what exactly was lifted. with president's order. And I forwarded the links to Ellen. So I guess by now it should be posted on the Facebook and on FSOMA website. The major lift which got out was HIPAA compliance for the use of appropriate platforms for telemedicine. Now, temporarily, and I want to highlight, temporarily, only during coronavirus emergency, our patients can use Skype, FaceTime, and even regular phone to access us. They cannot use any multiple people-facing technology as Facebook, Twitter, and all that. That is not permitted. But phone, Skype, Facebook, yes, you can do it. You don't have to have HIPAA compliant platform at this moment, because one of the reasons why it was lifted, we have crashes on those platforms whole day long, and just literally Thursday, Cleveland Clinic as well issued for us specific guidelines how to bill and record phone conversations with the patients, because technology is not capable to handle amount of virtual visits.
Perfect. Thank you for that, Helena.
Yes, but nevertheless, minimum standards of our records remain in place. We still have to record the encounter. Therefore, if your patients possibly can, like we say, minimal standard for evaluation of the patient in our practice is phone, the tongue picture. So your patient can email you tongue picture at the current time. It will be perfectly HIPAA compliant temporarily. If you have electronic software, they can upload their tongue via electronic medical records platform. How and what and so and such, I speak a little bit more in my class. If anyone interested, they can go on asiantherapist.org/academy and take the class itself. But in emergency circumstances, you can prescribe herbs over the phone consultation for established patients. If it's a new patient, you at least need some type of face-to-face contact. So it should be Skype or Facebook at least. And you can see new patient in Florida, but you cannot see new patients in majority of other states via telemedicine platforms. In majority of the cases, it's geared toward established patient.
Okay, perfect. So keep your telemedicine consultations right now in Florida, or patients that reside in Florida.
In those states which you are licensed at.
In the states you're licensed at. Okay, perfect. And that answered another question. There is one question: where do we get the viral infection guidelines that David was talking about? Are these the links that you shared, Ellen?
Yeah, I think the CDC is the best, and I think that the Florida Department of Health also has a good resource for that. You just go right on like COVID-19 DOH, and it'll populate all kinds of information for you.
Okay, perfect.
And unfortunately, they're still using a standard where it's fever, sore throat, and shortness of breath. Recent travel, contact with somebody from overseas, from an affected area. But that's only like 5 or 6 questions I think I found on the DOH. But the CDC has an expanded version of that now to like 16 questions or something.
What we do in Cleveland Clinic right now, though, yes, it is a different state, it is in Ohio. We shut down all non-essential patient visits. So all our acupuncture is canceled until April 1st right now. In
Yeah.
our department, out of 8 acupuncturists, I'm the only one who is still seeing patients and only via virtual visits. The rest of us are salaried employees and we work on paperwork. So hospital, Cleveland Clinic as a whole sees only emergency surgeries, infected patients, those patients, treatments for whom can be life-threatening, like immediate necessity for chemotherapy or something like that. Again, if high risk of spread of metastasis.
Yeah.
All other appointments for all providers, routine examinations are canceled, at least at this moment.
Thank you, Galina, because that was kind of get to the next topic I wanted to get to.
Yes.
And this is, so first is the legal question. Acupuncturists don't want to be, pushed aside as non-essential providers. And I think I provided evidence to support that we're not. But the second and more important question is providing essential medical services. And trying to get a handle on, what is an essential versus a non-essential medical service, and is the care that you're providing in your office, how do you substantiate it's one or the other? And I would say, reasonably speaking, that the vast majority of all care that acupuncturists provide would fall under the non-essential medical service. For this reason. The term essential medical services is closely associated with another term called essential benefit. Okay, and it's helpful when trying to interpret the meaning of one to examine the meaning of the other. And what I mean by that is most states, including Florida, largely follow the Centers of Medicare and Medicaid Services to establish or expand or define what an essential healthcare benefit requirement is in a given state. And it's partly wrapped up in what insurance pays for. But what is important to understand is that acupuncture treatment is not an essential benefit under the Centers for Medicare and Medicaid Services. An essential benefit. We just went through a big, successful, decision from the Medicare to include acupuncture for chronic low back pain, but they didn't go as far as to say it's an essential benefit. It's for a very specific reason. And that's why in most states, including Florida, acupuncture services are not mandated by the legislature as an essential benefit under insurance plans. So it's reasonable to conclude that licensed acupuncturists, although we qualify as healthcare practitioners, that we don't generally provide essential medical services when performing acupuncture, unless you're licensed under another chapter as a nurse or a physical therapist in some instance, and somehow you're tied to an essential healthcare service like respiratory therapist or something like this. So I include that because all of the discussion that we're having now and all of the decisions that people take away from it are largely going to be viewed through a lens of hindsight. What did you do? Why did you do it? What was your thinking about doing that in the event that something irregular happens in your office or happens to one of your patients? And so I'm trying to give you guys as much information to go on to just ask yourself some of those critical questions about personal protection equipment. How do I assess the health of one of my patients in a way that's compliant with the CDC recommendations or the Department of Health recommendations for COVID-19? How is my office configured in such a way that I can keep patients from contaminating myself or my staff? Or how can I keep my staff or myself from contaminating a patient, especially when there's such a long period of time between when someone is a carrier and has the infection and from when they're actually presenting with symptoms of it. I think it's the real struggle for us to be able to substantiate in every instance that, with the benefit of hindsight, if somebody is sick and God forbid dies from a COVID-19 infection, and the Department of Health and family attorneys will be curious where their relatives have been in the last 2 weeks, and they start backtracking. They were at Publix, they were at Ace Hardware, they were at Sam's, picking up things, and now, oh, they were at their acupuncturist's office. Questions will be asked about your, standards, procedures, methods for providing what's essentially a, care that's non-essential, given the standard that we're hearing from Galena and what we know that physicians around the state are doing in terms of they're being ordered not to provide elective and non-essential services. So it's just, food for thought. Everybody has to consider that very carefully. FSOMA really wants to provide you with what's the most up-to-date information. It's an individual responsibility as a business owner, as a licensed healthcare provider, to sort of weigh and measure, where you fit in the healthcare delivery model, and what risks are you willing to accept for your business, and what risks are you willing to impose upon your patients. So I think that's my last word on that, unless anybody has questions, okay? We've provided a couple of additional links with this handout that I have for you guys that are for flyers from the CDC on how to stop the spread of germs and what to do if you're sick. It can be helpful.
Addition to saying on protective measures. Right now in Cleveland Clinic, in every building, there is a policy. Any employee coming to work gets questioned the same questions, and mandatory is measure temperature.
Yeah.
And if our temperature is higher than 100.4, we are sent home and reported to occupational health department. Acupuncture absolutely is non-essential service. So I would follow the Cleveland Clinic example, and I would not bring patients to the office now. My private practice, acupuncture patients are all canceled, at least until further notice. But the service which I do provide, I do offer herbal telemedicine consult for all of my patients, and I utilize third-party compounding pharmacy, which is Crane Herb Pharmacy, and all of my prescriptions are drop shipped to the patients. So nobody is exposed whatsoever. Nobody comes to my office. And in majority of the cases, we will see initial cases, we will see mild cases, we will not see those extremely sick people. So we are useful, at least at the beginning. But if there is severe symptoms, patients must be referred to the hospitals who are equipped appropriately handle them.
Yeah.
That would be my suggestions. Stay with telemedicine consults. And even if you're not prescribing anything at the current moment, for your patients who are in tremendous pain, who are panicking, remember, you are paid for consult. You're not paid for needles. You're not paid for herbs directly. You're a consulting provider. You can just calm the patient, advise on handling the procedures, advise on where to go, how do not panic, make a meditation for your patients, have a group discussion via telemedicine visits, calm them down, and you can get paid for it. It's called meditation, it's called consult, it is within our scope of practice.
Yeah, excellent advice, Galena. That's I think that's where, FSOMA's opinion on this is the same, is that you really have to find ways to reduce that personal contact with patients, because being able to really assess the health of somebody in a way that's accurate is harder and harder because the virus tends to, like I said, a long incubation period with this, where your patient could be infecting people in their household, in their community. Having them travel to your office is probably at this point not something that I would advise a colleague. I would also sort of offer one of the last points I wanted to make this evening was that there's a link in the handout that I'm going to make available for you guys. That's from the Department of Florida, from the Department of Health. It's a healthcare provider resource availability survey. And this is in response to COVID-19, is going to require, this is a request from the Department of Health, requires a whole community response, integrating public-private healthcare partners to meet the needs of the community. The State Emergency Operations Center is seeking to identify resources available in the local healthcare infrastructure that can be redirected to support the response when Florida begins experiencing medical surge. And then they ask you to please respond by clicking on a survey link below. And basically what it's gonna ask you is to identify your clinic name, your contact information, and then a list of materials or staff that might be available on a contract or volunteer basis to support the local healthcare community response. So if you don't, if you don't have, personal protection equipment to donate, or you don't have nurses or other people that are affiliated with your practice to lend to the effort, you can simply scroll to the bottom of that questionnaire and include your name as somebody who's willing to volunteer to work in a community effort to support whatever the local health department needs from what you might be able to contribute. So it's a way for us to also stay involved and find ways to support patients outside of our office. I definitely think that Galina is sharing excellent advice. If you have a patient database, now is a good time to make use of a quick little newsletter, send that out. And if you look into your calendar and you want to host a chat, an update, a meditative event, or something that's just a group session, you should consider inviting patients to that, and then using your telemedicine options to bill for your consulting time and provide services through consultation to your patients. I think it would be probably a relief to them to know that they could reach out to you.
I see in the chat that please explain how massage, chiropractor, physical therapy is essential, and yet we are not. None is essential. The only essential services is emergency surgery, emergency admission to ER department, chemotherapy for those patients who have serious risk of spreading of the cancer, and treatment of infectious patients. That's it. Your primary care physician is non-essential service at this moment either. They do not see patients in person. All of those are virtual visits in regards of essential services provided in person. That there is a big clarification. And yes, it looks like they shut everything down in Florida as well. Here in Ohio, all bars, all restaurants, all massage places, all hairdresser salons, all spa, all theaters, everything is shut down.
Yeah, and Florida is right behind. This is we're probably within 24, 48 hours of a similar ordinance, if we haven't seen it already. So it's trying to tease the two things apart. What we're saying is acupuncturists as licensed healthcare providers are essential healthcare providers. So nobody's saying you're not essential. What's important to recognize is that we provide non-essential services, mostly, especially when it comes to acupuncture as an in-person encounter. Dermatologist is an essential healthcare provider, but this discussion would sort of lend itself to a routine examination or ultraviolet treatment for a patient is a non-essential healthcare service, medical service. So they would not want to have patients, fulfilling appointment requirements at this time. And doing a little bit of looking, it's not just necessarily an ordinance and a procedural and a legal thing. From an ethical standpoint, certainly physicians, healthcare providers and doctors, a part of their ethical code includes this weighing this discussion we're having about the use of resources for non-essential care. And so we're talking, you can be tactile resources like masks and gloves and things like this. And then there's, other resources like time, energy, output, and distraction that come along with maintaining non-essential medical services and visits in their offices. So it's pretty clear the attitude from the CDC, the direction that the Florida Department of Health is moving in, some of the decisions being made by governors and mayors of large cities and towns, sort of lending itself to minimizing and eliminating personal contact with non-essential medical services and patients. Now, this, if you can make some unique argument why you absolutely have to see somebody, that's your own decision and that's your patient's decision. I'm just suggesting that as a colleague that you consider all of the things that we discussed in terms of not the benefits of providing care, but the burdens and responsibilities that go with that. Because if you're to be held accountable for, brought before somebody to explain why you thought it was essential, hopefully you'll have a coherent answer to that question. Okay, guys, any other questions?
Thank you, Dave, for saying that. Yeah, and I think it's important to clarify that it's not that we're non-essential. We are essential for medical. We're just not essential during this current health crisis because we are running the risk of spreading it as well.
Right. We're not essential to the extent of providing acupuncture services. If you were to walk into your local health department and say, hey, I'm a licensed acupuncturist, I'd like to be able to support you in whatever role you think I can be helpful in. And they might say, sure, take this gown, take this mask, and go into that tent, and I want you to take temperatures for the next 2 hours. We're certainly trained and skilled enough to do something like taking temperatures or completing a healthcare questionnaire. It's about rendering services. Which types of services are you providing, and are they essential at this time? That's all. So, I want everybody to feel confident with their training and licensure that there is a place for a role for everybody to play. It's just how you do that and how you choose to do that is important. You have to consider what's going to be acceptable locally and statewide.
Yeah, our role in the current model, I'm sitting whole day and responding to my panicking patients.
Right.
What to do?
Right.
Yes, what to do? So remember, right now, billing will be significantly easier. Very many of private insurances will reimburse telemedicine services much easier. Unfortunately, we will not be able to bill Medicare for telemedicine by very simple reason why we cannot bill Medicare for acupuncture. To the best of my knowledge, Medicaid doesn't pay in Florida for acupuncture either. But private services, call them and clarify, they may pay for your telemedicine services. Phone consult will be considering at this moment telehealth service. It will be based on minutes. Please take my class, look at other resources. There are specific codes what you need to use, and you must indicate time. But please call, verify benefits of the patient. Please, before you engage in phone conversation with your patient and bill them, inform them that it may be not paid and they might be responsible for charge, just to stay on the ethical side.
Thank you so much.
I want to remind people that things about insurance billing, Medicare, they are changing. what David's talking about essential medical benefits, and the categories are not set in stone. And this is where our action, our talking to our patients, our talking to our politicians, about what we can do for people is so important. And there are groups working on, coverage for acupuncture. So don't feel like it's what we're saying is set in stone, but this is the reality at the moment. This is the rain that's coming on us right now.
Yeah,
and
even
just
Wednesday,
surf
we
it,
could
deal
not
with it,
bill
and
for
then,
phone conversation.
figure out how to
On Thursdays,
improve.
we could bill for service to the patient on the phone.
Okay, guys, I just had an update from our attorneys at Rutledge and Cena, and so I thought I would just share this if I can live, okay? It says, all hospitals, ambulatory surgical centers, office surgery centers, dental, orthodontic, endodontic offices, and other healthcare practitioners' office in the state of Florida are prohibited from providing any medically unnecessary, non-urgent, or non-emergency procedure or surgery which, if delayed, does not place a patient's immediate health, safety, or well-being at risk, or will, if delayed, contribute to worsening of a serious life-threatening medical condition. Okay, this is from Governor Desantis in the last couple of minutes. So this is where I think we're getting pretty clear guidance that certainly in person, in office visits, at this point, it was different at 5:09 when I started this conversation with you guys. I'm pointing at the clock. It's been less than an hour, and now we're getting different guidance that tightens the requirements, okay?
Yeah. Every day, every hour, everything is changing so quickly, and we're having all to adjust and process mentally very, very quickly. Yeah.
Right. And this is the thing, I think, there are wordsmiths out there that will want to take to task some of the definitions that they're providing here. But I think, it has to, you as a provider, you would definitely be responsible for establishing how and why it was that the care you provided was fit this model that's being described here. I'm sorry to stumble, but how it is that you could reverse engineer what the governor is saying and say, hey, if I didn't treat my patient with acupuncture or in person in some way, this would have contributed to a life-threatening medical condition. This would have placed their immediate health or safety or well-being at risk. These are things that I don't know that you really want to be taught necessarily parsing words with the governor on this. I know when it says well-being, we might say that, I needed to do, yin tong quickly on somebody to keep them from getting too worked up. I think we have to bear in mind the standard of care and what what colleagues and non-colleagues might say in light of reviewing our decisions and actions. Okay, look at it through a broader lens.
To conclude that, yes, absolutely. Close the shop down, do telemedicine, tighten your paperwork.
Wonderful. Thank you, Linda. So let's continue going over the comments and questions.
Yep, please. I'm sorry.
Okay. We have someone here that says the CDC is giving a free class on COVID-19. Disna, sorry if I pronounced it incorrectly. If you have that link, please share it with us on the chat box so that we can all have it, and I'll make sure to also share it on our social media and with the rest of our members. And we have here a message from Nor from AccuMarket, which is our local supplier. And he is doing drop shipments for patients with the supply that they have and the supply that they have coming in. So this is going to help support all of you in your efforts to continue supporting your patients and your family and friends virtually. Yeah. PPE or personal protection, yes, we are talking about face masks, gloves, gowns,
Shields, gowns, everything.
the,
Shields, gowns,
yeah, the gowns, there's
shield.
a shield, a face shield, along with a face mask. You have your gloves, the gown, and I think you also have to have foot covers. Yeah.
And they're not available.
Yeah. Why would we close if others can come here and practice? Well, no, that's not what David said. Do you want to run over that again, David?
Yeah, okay. So they're saying, you know, the Surgeon General of Florida has relaxed the requirements for out-of-state healthcare providers. I don't know that they even contemplated acupuncturists, except that in the ordinance that they provided, it was Chapter 456, number 4, which covers definitions, and it includes us. So other acupuncturists are welcome to come. Again, I guess we're looking at separating for everybody's mind, in their mind, essential healthcare provider versus essential healthcare services, medical services. So if an acupuncturist from Georgia wanted to come to Florida and volunteer at Tallahassee at the Department of Health to support providing care, you know, taking temperatures or helping with paperwork or doing some sort of supportive role, they can do that. And if even to the extent they maybe were giving what you'd consider medical advice. Somebody asked you a question, you answered it, but you did not perform acupuncture, but you're performing some medical function and you're practicing the limited scope of medicine, then they're saying that you're welcome to do that. In all honesty, the spirit of what the Surgeon General was trying to accomplish is that they recognize, and Galina covered this as well, is that we have a lot of people that are from out of state here in Florida. They may have been planning on going back home, but because of the travel restrictions and recommendations, they're choosing not to. But their doctor is practicing in Tennessee. Is they're allowing physicians in Tennessee, if they have an active clear license, to provide medical services for people who are physically located in Florida, which under normal circumstances, they would not be able to do because they're only able to practice medicine with patients that are physically in Tennessee unless they belong to some sort of compact that allows them to practice in multi-states. So it just happens that acupuncturists are included under this broader guidance from the Florida Surgeon General. Is that helpful?
Yes.
It applies only to telemedicine services, telehealth services, which at the current moment includes the phone call.
Right, thank you.
Okay. It's important to review malpractice guidelines on telemedicine. For that, you should call your malpractice company and make sure that you're all set with that, with telemedicine.
Yeah.
To the best of my knowledge, then I was teaching telemedicine class at FSOMA last summer. I actually spoke with Acupuncture Council, Marilyn Allen, and our malpractice Schlitz services. Insurances are based on precedent. If you do not follow legal practice of telemedicine and you are sued, then there will be a precedent. So far, there is nothing in our insurance policies which prohibits us to act in accordance with our scope of practice in the state where we are licensed. It's why we are practicing in telemedicine in the state where we are licensed, and we are following our good practice standards.
Perfect, thank you. Is this still in effect for disinfectant guidelines? This is an article from, I'm not sure, maybe David and Galena can view the link. I will send it to them so that they can review, and I will have that answer for you shortly.
What I would say is the most up-to-date one I had is at the bottom of topic 2 in the handout that I sent you guys. There's a link that says CDC Coronavirus 2019 Community Organizations Cleaning Disinfection. That link right there opens up to the guidance that's
okay,
most accurate from them. It's at the bottom of that page, bottom of page 1.
Perfect. So this is a Galena question. So we can't see new patients currently right now via telemedicine since we haven't done a face-to-face.
Telemedicine appointment considered to be face-to-face as long as you physically see the patient, be it Skype, FaceTime at the current moment, only at the current moment. Then that emergency will be lifted. It's specialized telehealth platforms like VC, Teladoc, American Well, and many others. But in state of Florida, in telemedicine law, it specifically states that we are permitted to establish relationships via telemedicine for initial encounter. It's only in Florida. In the rest of the states, it's primarily established patients whom you have seen before.
Thank you.
I want to question, Galena, your handout mentioned Facebook as not being an option for telemedicine.
It's changed. It's changed recently on March 17th. Federal guidelines got out where they lifted HIPAA compliance for the period of coronavirus emergency. Due to immense number of elderly, doesn't have computers, doesn't have smartphones. They cannot operate with modern technology. All what they can do is to call their provider. So it's why HIPAA compliance have been lifted for right now. But the moment emergency finishes, it will go back.
Okay, perfect, thank you. This is a comment. Some patients with positive corona do not have fever. Yes, this is one symptom of several, but not every patient will have all of them.
I can answer actually on this question as well. I have been following Dr. Chen webinars quite a bit on how they treat coronavirus in China. And majority of the cases, what I see is actually cold dump invasion in the lungs. With cold dump, and if your patient has a pre-existing cold constitution, they will not have any fever.
Mm-hmm.
Right. Thank you for sharing that.
I think they won't have any early stage fever. Their fever will present like 3 weeks out, like when things get real severe.
Yes, then it will turn into the damp heat in the lungs, or even maybe penetrating into the blood or urine level.
Okay, perfect. So could I stay open for my cancer patients?
No.
No, you cannot. There you have the answer. Can you care for your cancer patients in a way that you guarantee you aren't going to give them the virus? I don't know, Galena, David?
No, with the current order to close down, which just got published by the governor, no, you close the shop and the only services which you can provide is telemedicine.
Right. I think Kalina was talking about cancer patients earlier, but she was very specific in her choice of wording, and I'm sure it comes right out of the statute. It was for treatment that included chemotherapy specifically for instances where there was concern about metastasis. So this isn't treatment of all cancer patients, and it's not treatment of cancer patients how you want to do it, or any of us might want to do it. It's specifically, even in a hospital, if they were going in for some oral therapy that was not a chemolytic, it probably wouldn't qualify. You know, if they had some
only for extra aggressive cancers.
Exactly. So it's just, and it was not simply to treat them, but to treat them the way it was prescribed, as Galina described it. It's treating them with chemotherapy. And since we don't provide chemotherapy as licensed acupuncturists, treating cancer patients is outside of what's allowed.
But if you offer in for your cancer patients herbal therapy, you still can do that via virtual consults.
Yeah.
All what we're talking about is just in-person visits, that which is prohibited now.
Yeah.
Okay. Is there any way personal protective equipment would be made available to us, particularly masks? Not just now, but even after the peak has passed. Are you an entity advocating for acupuncturists to also have priority?
I would guess that it's a question of availability at our vendors like AcuMarket, Lhasa, Crane, and some of those, but nobody will supply any protective equipment to us as a priority in any means. Hospitals right now in shortage of protective equipment in contagious patient department and in emergency surgery departments. We are last on the list.
Thank you. Did you also say that you have suggested needling protocols to share? No, no one has said that. In this live, no one's talked about needling protocols. I think as FSOMA, our stand is to also isolate and practice your telemedicine. Lisa says, however, if we're treating COVID-19, we're essential in a way. And since most people will just be told to go home when they come down with this, and when the healthcare system explodes, people will need a place to go for help, and we can help. And John Chen is providing information about antivirals and other medicinals used in China successfully.
You are very welcome to help the patients, even if they are sick with coronavirus, but only via telemedicine, not in person. It's a governor order now. There is no arguing any longer.
Right. No, I mean, the governor has made it clear, and anybody who defies what the governor is asking, I know on moral grounds, on any other grounds, you know, they do so at their own risk, their own peril for their
and that will be a legal action from our insurance for sure.
Yeah.
Right. So at this point, FSOMA stands with the state order to.
Yeah, I mean, our recommendation is that acupuncturists follow the law.
Yes.
Okay.
So no face-to-face, no personal acupuncture, just do telemedicine. Galina is not doing acupuncture, she's doing telemedicine. Again, John Chen has been doing lectures with Lhasa and Lotus. And there's a bunch of other platforms regarding COVID-19 and herbal formulas and medicines. We encourage you to stay up to date with that. And that's going to help you effectively work your telemedicine with your patients. We already talked about essentials. Or are we also required to have a hospital relationship to work during this time? No. No one's working at this time.
No, and that's the thing. You may be affiliated with a hospital, you know, somebody who's employed by a hospital like Galina is, or some other healthcare center, and they're going to provide, you know, policies and guidance that probably are even more strict. They're probably preempting what the governor just said, in that they're keeping non-essential staff out of harm's way. They're protecting the staff, and they're also protecting patients. And the bottom line is, by reducing movement among people, then we can at least hope that the viral expansion will slow and decrease sufficiently that it's no longer the problem that it is.
This morning I had meeting via hospital handbook project website. Megan was hosting us. So majority of us who work in the hospitals, I mean acupuncturists, are actually on suspension. We are work from home in majority of the cases. Majority of us now are literally tightening our standard operating procedures, myriad of paperwork which any office has. If we are salaried employees at this moment, at least to the best of my knowledge, majority of us are paid the salary to do so, but we are still at work, and we still consider to be working, even if we are working from home.
Perfect, thank you. Here is a link, let's see. Okay, sorry, I just had a brain freeze. I wonder if I asked this question, and I'm sorry if I did. Has anybody thought ahead, if we are non-essential and the PTs are, they will start practicing dry needling because we are non-essential? David?
Yeah, I mean, the only way I can respond to that is that dry needling is a non-essential medical service at this point. It's not life-saving. It is not for imminent care. And there's been suspension of all medical services that are non-essential to life-saving measures. And this is for people that have had a heart attack and they're about to expire. They've got life-threatening concerns that are related to trauma. They've got infection with the COPD. All medical resources, personnel, and equipment are being marshaled at this time to address critical life-saving measures only. Anything that can wait will wait. So physical therapists were just suspended, as well as acupuncturists, chiropractors, and everybody else. Physical therapy outpatient clinics are not going to be open. And they may have physical therapists in a hospital, but if they're not providing some life-saving care, they're not doing post-surgical hip rehabilitative work because there's no hip surgeries being done. They may be duly licensed as a respiratory therapist in an ICU somewhere, but you have to sort of keep ourselves focused on what type of care is actually being provided at this point. If you showed up at a hospital with anything that wasn't life-threatening at this point, you're likely being turned away and told to come back, in 3 months.
Thank you. Okay, this question has come up again. We want to make sure that you're getting this. Are you recommending that we do not see new patients via telemedicine? No, telemedicine, like Galena said, face-to-face, you would need a camera. So you can see new patients. Is that correct, Galena? But through
Correct.
the camera.
Yes, correct.
Okay. If we are looking at the service of acupuncture as non-essential, life-saving, thank you, is the recommendation that we respect not treating patients until this has been lifted?
Yes.
Yes.
That's acupuncture and in-person services. There are things that we do, whether it's patient education, herbal consult, refilling herbs, modifying herbs, things that we could do via telemedicine that serve our patients remotely. So it's not like you can't have any contact with your patients. We're just under orders that we cannot have direct contact with them, in-person contact with them.
Right, because of the risk of spreading the virus.
Exactly. Or I don't want to necessarily assume I know all the reasons, but that's probably chief among them. There may be other reasons.
Massage is essential. No, massage is not. Massage. Okay, it says massage is essential. Most massage insurances are recommending not massaging at this time.
They
Correct.
can't. The governor just told them that their offices are closed.
Okay.
And I just want to emphasize that came in as we were here in the meeting.
Yep.
That was not something we knew before this meeting started.
Right, like David said, this just came through. Our attorneys just communicated with David about this. Okay, when you say bill for telemedicine, is this for insurance patients only?
If patient insurance is paying for telemedicine, yes, they will pay you. But if patient insurance does not pay to acupuncturist for telemedicine consult, they will not pay.
Right. So then at that point, it's a private patient and you send them a bill.
Yep.
Okay, some of you have shared a couple of documents. You can share documents with each other through the thread. Just know that this is not where FSOMA currently stands at the moment, okay? Yes, this video is being recorded and we are gonna upload it to YouTube and it is going to be shareable. For those of you that have registered, what we can do is that we can email you the YouTube link. Once it is uploaded, we'll probably have that by late this evening, if not tomorrow sometime, and we'll get that done for you. Sorry, I'm just going over, make sure I haven't asked again the questions. Take a vacation.
I mean, I'm telling you, I hope everybody on the line that's patient enough to stay with us on this understand, you know, where we fit into the healthcare scheme and what's going on. I mean, picture all of the elective surgery, all of the consultation and disruption there is in the medical delivery model right now. I mean, there were people who've been planning for months for neck and spinal surgeries, for hip replacements, knee replacements, other, important things. That's just not going to happen. It's not going to happen. You know what I mean? So it's a remarkable place and time in our history. And so I'm glad everybody's asking the questions they are. And I certainly hope that as a profession, we sort of take it a little bit in stride, given what we see with our healthcare colleagues. We're not being singled out in some way. This is just the state of affairs. And when things normalize, then we'll be reinstated.
Someone said they're ready to close down. And you know what, guys? I will tell you from a personal standpoint, I was thinking of doing house calls for the patients that are not symptomatic, are not showing signs. And after our video today, I'm not going to go anywhere. I'm not going to do house calls. I'm just going to do.
It would be illegal. We order it to close.
Yeah, we're all ordered to close. And I'm glad that actually was sent to you, David, as we were doing this video. It's kind of perfect.
I know.
Guys, what is the funny picture is to see huge Cleveland Clinic call center all on the calls, calling every single patient, canceling next 2 weeks of the appointments. Girls look like vampires with broken blood vessels in their eyes, stare into the computer that much, and having their voices lost because they're speaking so much and every patient is so irritated.
Yeah. The chat is not going to be available. We're not copying and pasting the chat. We are going to, the links that we have shared and talked about are going to be on the FSOMA website, FSOMA.org, under announcements. The only thing that will be available after today's live is just the video recording.
Hang on, I'm going to post it in the chat right now if you want to grab it. It's the PDF of the executive order, and I will put it on the announcement section of the FSOMA website.
Okay, Gretchen just shared also the executive order in Florida is following the date of expiration of Executive Order 2052, which is an expiration date currently of May 8th, but subject to extension. Whenever they lift Executive Order 2052 State of Emergency Declaration in Florida, this EO will automatically expire.
But stay tuned, it changes every hour. In Cleveland Clinic, I receive updates in emails literally every hour, and it's maybe completely 180-degree opposite of the previous one. Just stay tuned. Follow the FSOMA website, follow the Facebook of FSOMA. That is your best resource. Florida State Association is unbelievably great.
Thank you, Galina.
You know, I see it across the United States. You guys are the best.
Oh, thank you.
Thank you. House calls, no more house calls. I was also thinking that, and you stay grounded, you stay home, you call your patients over the phone. Sorry, it's taking me a while because all of you are engaging with us and asking all questions and comments, and I love it. Thank you so much.
I can clarify a little bit on the house call, because what
Yes.
they're canceling, they're not canceling just office, they're canceling non-essential procedures, services. It's why house calls fall in exactly the same category. It's personal contact, which is prohibited.
Restaurants can only do takeout now.
Yes, takeout. That what is telemedicine for the restaurant? Yes.
That's true.
Okay.
So as long as somebody can either get the herb shipped to them, or I guess they could drive by your clinic and you could meet them outside and hand them a bag of herbs, that works, but you have to keep notes on
Even don't meet. Put it outside of the door.
Put it outside the door, no personal contact. Is that what you're saying?
Yep.
Okay.
Because they're recommending a distance of 6 feet between people.
Yeah.
So as long as you can be in your office, you just can't have patients in your office. So you can go and do your work, reorganize, file, finally do your electronic, stuff, or shift from paper to electronic, or any evolution or innovations you want to do. This is the time to do, but no patients.
Good time to review the inventory, clean out the paperwork, clean out the office, and just to say, guys, calm down, don't panic yourself. Then we get in all this data from Italy, from China. Please do not forget that living circumstances are completely different. I am a foreigner, so I know how crowded people live. There will be 3 generations living in 1-bedroom apartment in many of the countries. People travel public transportation. So majority of the United States, we live in such a luxury of spread out houses. We travel in our personal cars. we are not anywhere in such a bad situation as other countries are. And thanks God, they taken a great precautions to protect the public. So I hope that we will get it easy comparatively.
Thank you, Galina.
Thank you, everybody, for attending. Thank you, David, Natalia, and Galina, for the great comments. Natalia, you want to take us home?
Yeah, we have 25 new other messages. I just want to make sure
Oh.
that you all get your answers and everything is clear. So we are clear on you're shutting down your brick and mortar. You're not seeing patients face to face unless it is virtually through a camera. And that means, yes, you can see new patients virtually through the camera.
State of Florida.
In Florida only.
Yes.
All right. Let me just scan through this really quickly. When will we know how long this will last? We're all in the same boat.
Right, well, I think maybe we can talk about updates. And I think, we're going to probably share an email with the profession as best we can. But we'll plan maybe at least once a week doing some sort of update, because as Galina said, everything is going to move pretty quickly. And as things are changing and developing, we can, so long as the technology is available, we can continue to do these types of updates. So expect some information from us next week on another planned call, okay?
We'll try to post on Facebook and put on announcements on the FSOMA announcement page.
Yeah.
Yeah. And I think Gretchen here has said that the executive order for Florida will expire May 8th. But like David said, 1 week, I don't have the reading for this, but we will post and update you guys as frequently as we can. Yes, it is devastating effects on the moral and mental health of our clients. We are all in this together. We're all suffering. And we all have to be strong and supportive for each other.
Okay, guys. Thank you, Natalia.
Yes, don't do house.
There's a little place to save the chat next to the to all participants. You can try saving the chat there if you want.
Is it okay to provide herbal medicine? Yes, so you can do that through your telemedicine work. Where can we get info on carrying out telemedicine correctly? Galina.
I posted it. Yep, I've got her link posted there.
Okay, so guys, go ahead. The website is asiantherapies.org/telemedicine.
And her website's had some problems this afternoon, so try it tomorrow. It didn't load for me tonight, Galina, so it may still be a little funny.
It might be a little funny because all of the technology right now is overwhelmed. At least they're saying for me that it's allowing 5 seconds to load. At least right in the current moment, it is loading. So, but please be patient. Yes, unfortunately, technology crashes are all across the border. Right now, it is difficult because everybody and their mama is on virtual visits, on internet, and we don't have a 5G yet.
Okay, thank you all.
Yeah,
Thanks,
I think that's it. Everything else seems to be Hey, Jane.
Thank you all, guys. Appreciate a lot.
Okay.
Yeah, thank you, everyone. We will stay up to date with you. Thank you for joining us, and we will share the recording soon. Hopefully, definitely before Sunday. All right, thank you all. Bye, and thank you, Galina and David, for being here with us tonight.
Thank you. Thank you very much. Bye-bye.
Bye-bye.